Hello, Yellow.
You are tuned in to the Chatty Cat Pawdcast, a podcast created to empower pet owners with information needed to better care for their pets. This Chatty Cat Pawdcast is sponsored by Doodles Cat Sanctuary, where every cat is worth fighting for.
Welcome back. Thanks for tuning back in. One question I had that we didn't really dive into, and maybe we can start the episode off today with that and lead on to the new topic, which will be kind of the dental care for animals. But as far as regular diets for cats and dogs, if they were in the wild, what would that be?
In a wild, they basically hunt.
Hunters.
Yes, they hunt the food, and sometimes they get food after 3 days. Sometimes they don't get food, maybe a week.
Oh, wow.
So the nature has their stomach build up that they can live without food for quite a few days. The system is like that. But as they get domesticated, we feel that they need to eat twice a day, sometimes 3 times a day, because we eat 3 times a day.
Yep.
And they need to eat different kind of tasty food. So that is our mindset.
And this kind of leads us into today's topic. The animals that eat their delicious food, they use their mouths every day. And something that a lot of pet owners, I think, don't think about for a long time in their companion's life is dental care.
Yes.
And really taking care of their pets' dental needs just like you would with a human being. Yes, the life expectancy is not as long, but I think quality of life, the dental plays a big part in animals, especially as they get older. And I don't know a lot about dental in animals, so I'm just going to let you guys kind of take over from here. And look, tell me about dental care with animals.
So, if I have to start with dental, I would like to put that we brush our teeth, if not more than 2, but at least 2 times a day.
Yep.
And even when you are doing it every 12 hours, you feel sometimes your mouth is still not fresh.
Yeah.
So it means sometimes you have to do it after every 6 hours. You have to,
after every meal, almost.
After every meal, you have to do a brush, and because the bacteria starts growing fast in your mouth, because the body temperature is optimum there. There is a fluid, there is a like organic material, like food material is there. There's a perfect atmosphere for the bacteria to grow. And as you grow old, your immune system is not strong enough to keep that population of the bacteria under check. So you
in humans?
In humans.
Okay.
So I'm just trying to tell them that the same thing happens in dogs and cats. Same thing. When they are young, the teeth are early white, and you don't smell any bad smell from the dog's mouth. But as the dog start growing 2, 3, 4 years, they grow like every first few years they grow like every 1 year is 7 years of human age. So that's how they grow fast, and their immune system goes down, and then the bacteria start growing, and that bacteria basically is producing pus, and that pus start depositing on the teeth.
Oh, wow.
In the shape of like a plaque.
So the brown stuff I see on my dog's teeth is
plaque, pus. Yes.
Pus buildup?
Pus buildup of the bacteria and depositing on the teeth. And that, you can imagine how bad it is.
And it's by the gums.
It's by the gums, and then the gums start receding and going down, and they start becoming loose, and then the bacteria starts seeping inside, and there is a root which feed the teeth blood and nourishment to keep it healthy. When that bacteria goes into the root, start eating the root, and then when they start eating the root, the blood supply start going down, and your tooth start dying.
Wow.
So this process starts when the dog is like 4 years old.
That soon.
And when they're 6, 7 years of age, within 3 years, sometimes we have bad teeth, and sometimes we lose teeth. And mouth being the entrance point to the body, everything you are eating, basically you're taking the bacteria load to your stomach.
Mm-hmm.
And that bacteria start getting absorbed through the gut and start going through the blood and can cause other problems. So we have to clean the entry gate of the body, and that is mouth. So start brushing your dog teeth as early as you can.
They actually sell special toothbrushes and toothpaste.
Yeah, I own the toothpaste and a toothbrush.
Me too, I've never done it.
How frequent should you be brushing a dog's teeth?
Well, every day should be
Really?
done. But I know it's hard.
Oh man.
But at least once a week.
Wow.
But see, when the thing is when you get them used to it, it's not that hard because it's not like this unbearable task of, getting them held down and sticking it in their mouth. Because I've seen people who do it and it's literally like, hey, come brush your teeth. And it's not a problem.
Well, because the toothpaste tastes like peanut butter.
Yeah, they really don't mind.
Yes.
I mean, it's a couple seconds, a minute, whatever. It's the same. We only have to brush your teeth how many times, for how long. And
basically, you are making your pet healthy and your vet visits will be less.
See, me personally, it sucks. It's just like, it's not a daily routine, so I forget about it. And when I finally remember, because I see the plaque on their teeth, okay, once a month I brush them, but it doesn't get rid of the plaque. And
that is hard.
Is it too late?
Yes, it is hard. So you have to remove it professionally. You have to put the dog under sedation, and then they have a scaler that vibrates and break that plaque.
Okay, so that's part of dental care when it's kind of too late, but you can still go back and revert it.
You can go back and do it. And then the other part is that you take your dog to the groomer regularly. So find a groomer who does a good job. They do mention, we will brush the, but sometimes they ignore it. They don't do it.
Okay.
Because you don't open the mouth. You don't check.
Yeah.
But if you check, I think it's a good help. Groomers know how to brush the teeth, and they have a dog with them, and they should do it.
Yeah. Okay. So.
Oh, I was just, because he had mentioned about putting them under sedation. Have you ever heard of non-sedative dentals?
Non-sedative dental is basically you are just scratching the tartar.
You just pick it off.
Pick it off.
Yeah.
The inside, you can't reach inside the mouth.
So you're not really doing anything.
No, it's just it looks clean from outside.
Right, okay.
And that's the side only owner sees.
Right.
He doesn't open the mouth and look behind the teeth.
Gotcha.
So there is still a tartar and still a bacteria is there. As soon as it's done, after maybe another 3-4 days, that bacteria will go in the front and start rotting again.
So what about cats? Are cats much different than dogs in your experience? Maybe Jen also with your cats and teeth?
My cats, I think, are off the charts with dental issues. I don't know if anybody has any. Oh, we've had some really bad dental situations.
But that's partially because of the past history of the cat, not that you've been taking care of it.
Some cats have, I've learned, they're prone to, and maybe dogs too, they're just prone to bad teeth. You can do whatever you want, but their teeth are just not good. Am I saying that correct?
Yes, okay. Yes. Your how you biodegrade your food, how much gut bacteria you have, depends upon the absorption of the food. So some cats' gut bacteria is not good enough to absorb all the tooth, and they make more plaque. And then the bacteria start growing, and their pH system is important. So some cats are prone for periodontal diseases, yes.
So how do you do the same thing with cats as far as dental care? Groomers, brushing teeth?
Yes, we do recommend that people can brush cats' teeth. It's difficult, but they can when they are young. But otherwise, normally cats, their teeth should be checked regularly after when they're 5-6 years old.
Okay.
Yeah, the vet should do it.
And then the vet would then proceed to clean if needed.
Yes.
Okay. So you don't really brush teeth at home?
You know what, like you, I have this stuff, and then I look at it, and I look at my cats, and I think, how the heck is that going to happen?
Mm-hmm.
And part of it is because our cats come to us older and already sick. And I'm like, how am I going to train a 10-year-old cat that's diabetic, this, that, and the other thing?
The teeth are probably the least of its worries. Yeah.
So that's part of it. But I have always thought, like, if I ever was to start with a kitten, that I would ideally want to do that, but I have not.
There are some like wipes.
Oh, like dental wipes?
Dental wipes.
Oh, yeah?
That helps. That dissolve if you have a wipe.
So you just use your finger and then go in there?
Wipe, and then you can dissolve that tartar. There are
they sell them at regular...
regular...
pet stores?
Yeah, pet stores. Online.
Okay.
Chewy.com can sell those. Then there are some additives. We call it dental additives.
Oh, you're right.
Yeah, you can put those additives into water where the cat drinks. You have to see, some cats are very finicky. They don't want anything in the water. They want fresh. But there are some food additives that you can put 1 spoon in the food.
Yep.
And that helps.
This Chatty Cat podcast is sponsored by Milwaukee Walk-In Vet Clinic, home of the no hidden price policy.
The groups and the people that I communicate with that disease, there's something called plaque off that you can buy over the counter, and that's supposed to help also. I again have not used that, but
if you have adopted a young dog or a young kitten, then definitely your vet gonna tell you about the dental care, and as a vaccine routines every year or every 3 years. But the dental care should be done every year. You should take your pet to the vet, let him see the mouth, and let him judge whether the teeth needs to be cleaned. If he recommends that teeth needs to be cleaned, then ask questions. Questions like, okay, how often I have to get it done? So normally in my practice, I does like every 2 or 3 years. The reason is I always advise to like plaque off additives so that you can prolong
the visits.
Yeah. But if you are not doing anything, I have seen one thing. If you are giving you're making food on your own for your pets, the teeth problem are much less. Yes, they're much less.
And
I don't know why.
You don't know why?
I don't know why.
Huh.
But maybe the fillers or the additives in the food processing is such like that. The body doesn't. The body is not fresh after eating that bag of food.
Huh.
But versus you're making
natural
food. Yes.
Interesting. Is it similar to cats as well then?
Cats and dogs, similar.
Both?
Yes.
Okay.
Yeah. The owner who's doing it, I have seen the teeth. Even 10 years old cat, I have seen good teeth, white pearly teeth. And I never did cleaning. Who does the cleaning? She said no, nobody.
Yeah, sometimes I have some that it's fine. I have the two opposite ends. Some that it does. Their teeth are never a problem, and then the rest of them are
just gone.
Yeah.
Dang. Lucy also likes to crunch on apples sometimes, pieces of apples. Are those things okay or no?
I am not a big fan of apples.
Okay.
Because of they are not apples actually.
Oh,
because
modified.
They are modified.
Okay.
So they don't do good when they get absorbed.
That
so if you have a natural apple, sure,
okay,
that's fine. But I will give Lucy some baby carrots.
Baby carrots.
Baby carrots. You can freeze those baby carrots, and they become crunchy, just like a bone, and they like to chew on it.
Huh.
And then you can go green beans.
Green beans too?
Yep.
You can freeze them too, yeah.
Freeze them.
That's a good idea.
Yeah. Try them as a treat.
Okay, perfect. All right. And if you didn't take care of the dental, or if what you've been doing isn't enough to take care of the dental for your animal, what are some things that could happen. Sounds like the bacteria gets in there, kills the root. But what are the signs? What should you be looking for symptoms if something's wrong with the pets? Dental.
Jen, you have
some examples.
The signs and symptoms that I've seen, and Dr. Singh was saying that they're pretty bad. But cats are famous because honestly, they will go for a long time before you see these signs. I didn't have like sickly cats, and all of a sudden, their like drool is coming. I had one cat, the drool was literally just hanging, and she just sat, and I'm like, but yesterday you were fine. Like, I have no idea what happened. And part of getting dentals, like Dr. Singh was saying before, every 2 to 3 years is because when they hit that older mark and they start to get diseases that are not easy to treat, heart disease, dentals can't always be done. Or they're more risky. So at 10, and he saw her, she's healthy, she's checked out, we did blood work, her blood work is pristine, there was nothing wrong with her blood work. I said, just do it, because at 10 years old, she's already having a little bit of stuff. Let's just get it done, because if something else happens, I might not be able to do her dental, and then that's just going to make her other disease worse. Because it's all interrelated. If you're having all this bacteria, and then you have a heart disease, and your bacteria is on it, so...
It's like a part of a big puzzle.
The system.
Yes.
The system. Okay. You had mentioned x-rays. Is that something, how x-rays will basically show you how the root is doing, right? Yes.
The dental x-ray should be a part of like annual checkup.
Okay.
And in big dogs, even I recommend x-ray of the whole body as a annual checkup. Annual checkup. Okay. So annual checkup should be blood work, x-ray, urinalysis, and so x-ray you can do every 2 years.
Okay.
So just skip 1 year. Yeah. So then you can compare the organs, just like a spleen. Lucy has a spleen issue. Growth in a spleen. Yeah. We don't know whether the growth is a bad growth or just a benign growth. It will bleed or it's bleeding. We don't know.
Or when it appeared.
Whenever Lucy is sick, maybe she's sick of UTI, or maybe she's sick of any other reason, or maybe just a bad day.
Yeah.
Our mind start going towards that.
Yeah.
Oh my God, maybe it's bleeding.
Yeah.
So that's the reason why we should every year take an x-ray and make sure the spleen size is normal. In the teeth, dental x-rays, we are looking for root of the teeth. Because the top crown, anybody can see.
Yep.
There's no problem. On the crown, you are ruling out fracture in the crown with the x-rays, which you can't, if you can't see from the naked eye, you can, minor fractures can be seen.
You can see it in there.
The main thing is the health of the tooth is root. If the root is intact, there is a normal shape and size of root, and there is an abnormal. And your vet will show you this is the normal root and this is the abnormal root. Look at the x-rays. This part is missing. This is lighter. If the root is healthy, that's a sharp picture of the root. Now, the picture of the root is hazy. Is more like you can't clearly
blurry.
So that is the way to find out if that root is dying and then you have to get rid of the tooth. There's no way you can save the root.
I mean, you have to extract it. Basically.
You have to extract it.
And is that a major surgery?
No,
it's
not a major surgery.
Okay,
it's a routine surgery.
Routine to take a tooth out.
To take a tooth out.
There are vets that can do dentals, and then there are vets that only do dentals. And that while I appreciate their specialty, they're very expensive. Anywhere you go, they're very expensive. So you don't want to get to that point.
Yes. The thing is, the veterinary dentists are very, very rare. Normally, we veterinarians, with the practice, we take care of the tooth.
Yeah.
But sometimes things doesn't go the way we wanted it to go.
Yeah.
And we don't know how to fix that.
Yeah.
then they come into picture.
Got it.
Then we really need them. Like you told me, and I saw this case my first 2 years of practice. The owner said, "Oh, I was playing with tug of war and I broke the tooth." And I learned it.
Yep.
I said, "Oh my God." And then after a few years, same owner told me, "My dog is very aggressive." I said, I remember you were playing tug of war. He said, "Yes." I said, "That could be the reason." And then I start asking this question, how aggressive this dog is. Very aggressive. Do you play tug of war? Yes. So this is how you process the information.
And that's kind of what I do. Not being a vet where I have clients that take all these scenarios to me. The cats that I have the cats that we take care of teach me all that. If I had one cat, I wouldn't know half. I wouldn't even know a quarter of what I know.
No.
Because even the diabetic cats that we have, they are all different. They all process insulin different. So I can talk about the different scenarios in different diseases. Even the stomatitis with the mouth, I have 7 cats with that right now. Every one is different. Some of them had their teeth pulled out. Some of them only had left only the canines, because canines are very difficult to take out. So some of them have the 4 canines and all the other teeth are out and they're fine. Some of them have all the teeth out and they still have problems.
I would like to add, with the tug of war is like a bones. We use a lot of bones for dogs.
They sell a lot of bones in the stores.
And owner is thinking that he's giving bone to the dog and the teeth looks good and better. That is not right way. Mostly cases we have seen those bones dogs are chewing and they can fracture their molars, the big ones.
Oh wow.
And that fracture is then the bacteria which is already present in the mouth can seep into that molar and you can see swelling underneath the eye.
What?
Big swelling.
Wow.
That when I see that swelling, first thing I ask, do you give bones to your dog? Yes. Okay. Because of the chewing, there's a high chances that there's a fracture in the molar.
Wow. And then you have to extract?
Then we have to extract. So I'm not a big fan of giving bones pieces. They break in big pieces and they can cause internal issues also. And the mouth also. One more thing, the teeth are weak. The calcium and the phosphorus, they should be there for the proper teeth. So we should check always vitamin D, level of vitamin D in the body. Because dogs who are not exposed to the sun a lot, their vitamin D may not be the right quantity. And we need that in the right quantity for your healthy bones.
Does that usually get checked with blood work?
No, it's a separate test.
Do the vets typically do that test? Or do you have to request it?
We have to actually, veterinary don't do that.
Oh.
But it should be done. I always advise keep on giving multivitamins. It has vitamin D in it.
To dogs?
To dogs.
Cats too?
Yeah, cats too.
Does it come in pill form or where do you get vitamins?
There's a pill form, chicken flavored, liquid form. Yes, multivitamins. And you can read what ingredient it has. They normally have vitamin D3 in it.
Well, we've talked a lot about dental care today. A lot about starting to take care of your pets and continuing to take care of your pet's mouths, because it's really where all the nutrients come in, and what you eat is what you're going to become. So thanks for sharing all that information. I love this podcast. I learned so much already, and it's only like episode 5. So I'm hoping that you tuning in learned a lot too, and listening in. And I hope that people have questions and submit questions. What's the best way to submit questions to this podcast?
info@doodlesranch.org.
And they can also probably find that through the website?
Yeah.
And the website is?
doodlesranch.org.
Perfect. And Dr. Singh, what about you? If people have questions?
My email is mwvc4577@gmail.com.
And do you have a website?
Yes, the website is MilwaukeeWalk-In-Vet-Clinic.com.
Well, any last words on dental care?
Brush your teeth.
Yes, brush your teeth, people.
Brush.
All right. Thank you so much for tuning in. Thank you so much for the hosts and co-hosts and friends in the building.